What if I told you that regrowing your missing teeth could cost less than a single dental implant? Or what if it ends up being more expensive than a luxury car? The truth is, nobody knows for certain yet, but today, we are going to break down every piece of available information to give you the most accurate cost prediction for Japan's revolutionary tooth regrowth treatment. In this video, we're diving deep into the financial side of TRG-035, the Japanese tooth regeneration drug that is currently in human trials. We'll look at development costs, compare it to existing dental procedures, analyze pharmaceutical pricing models, and give you realistic price predictions for 2026 and beyond. If you're missing teeth or know someone who is, this could be life-changing information. So, let's get started. Before we talk dollars and cents, let's quickly recap what we are actually pricing here. TRG-035 is a monoclonal antibody drug developed by Dr. Katsu Takahashi and his team at Kyoto University and Toregem Biopharma. It works by blocking a protein called USAG1, which normally suppresses the growth of extra teeth. By inhibiting this protein, the drug essentially unlocks dormant tooth buds that exist in your jaw, allowing them to develop into fully functional teeth. Now, this isn't a pill you take at home. Based on current clinical trial protocols, TRG-035 is administered as an intravenous injection. That means you'll need to visit a medical facility. The treatment is given once, and then your body does the rest over the course of several months. This is important for pricing because we're not just paying for the drug itself. We're paying for the pharmaceutical compound, medical administration, and monitoring, pre-treatment imaging and diagnostics, post-treatment follow-up appointments, and potential dental adjustments as the tooth grows and keep these components in mind as we break down the costs. So what hard numbers do we actually have? Well, clinical trials are funded differently than commercial treatments, but they give us important clues. The Phase 1 trials that completed in 2024 involved about 30 participants and had an estimated budget of around 100 million yen. That's roughly $670,000. If we divide that by 30 participants, that's about $22,000 per person. But hold on, don't panic yet. This number is artificially inflated because clinical trials include extensive safety monitoring beyond what's needed for standard treatment, research staff and data collection costs, regulatory compliance expenses, and the development of treatment protocols. Real-world treatment costs are typically 50 to 80% lower than clinical trial costs once a drug is approved and standardized. The Phase 2 trials, which are ongoing now in early 2026, have expanded to around 120 participants. Industry insiders estimate the Phase 2 budget at approximately 500 million yen, or $3.3 million US. That's about $27,500 per participant. But again, this includes significant research overhead. What this tells us is that the medical administration costs are relatively stable, and the drug itself is likely the most expensive component. Let's put this in perspective by looking at what you would pay today for the alternatives. In Japan, as of 2026, a single dental implant costs between 300,000 to 500,000 yen, which is 2,000 to 3,300 US. A dental bridge ranges from 200,000 to 800,000 yen, about $1,300 to $5,300. And partial dentures run about 100,000 to 300,000 yen, or $672 to $2,000. In the United States, prices are significantly higher. Dental implants are $3,000 to $6,000 per tooth. Bridges can be anywhere from $2,500 to $15,000, depending on the complexity. And dentures are $1,500 to $8,000. Now here's the key question. Will tooth regeneration be priced competitively with implants? Or will it command a premium as a cutting-edge biological treatment? Toregem Biopharma has stated their goal is to make the treatment accessible to patients who need it. That's corporate speak, but it suggests they're not planning to price it at luxury levels. They want market adoption. However, biological therapies tend to be more expensive than mechanical solutions initially. Think about stem cell treatments or monoclonal antibody drugs. They often cost tens of thousands of dollars because the manufacturing process is complex and specialized. Let's talk about how pharmaceutical companies actually set prices for innovative treatments. There are typically three pricing strategies. Strategy 1 is cost-plus pricing. You calculate development costs, manufacturing costs, and add a profit margin for TRG-035. Total development costs from research through phase 3 trials are estimated at 5 to 8 billion yen. That's 33 to 53 million US dollars. If they expect to treat 100,000 patients in the first 5 years, they need to recoup about $500 per patient just to break even before considering manufacturing and distribution. Strategy 2 is value-based pricing. This is where you price based on the value delivered to patients. A dental implant provides 20 to 25 years of function and costs $3,000 to $6,000. A regenerated tooth is your own biological tooth, potentially lasting a lifetime if maintained properly. This could justify a premium price of $8,000 to $12,000 per tooth. Then there's strategy 3, competitive pricing. This means you price to compete directly with implants and capture market share quickly. This would put the treatment at $2,500 to $4,000 per tooth, making it competitive but not necessarily cheaper than current options. Which strategy will Toregem choose? Based on their public statements and the Japanese healthcare system's emphasis on accessibility, I believe they will use a hybrid approach, somewhere between competitive and value-based pricing. Here is something crucial that many people overlook. Japan has a universal healthcare system with significant price controls. The Japanese government negotiates drug prices through their national health insurance system. If TRG-035 gets approved and added to the insurance coverage list, which is likely given Japan's focus on innovative medical treatments, the government will negotiate a maximum reimbursement price. This typically results in lower prices than what you would see in the US free market. For comparison, cancer immunotherapy drugs cost 30 to 40% less in Japan than in America, and biologic drugs for arthritis are about 50% cheaper in Japan. However, tooth regeneration might initially be classified as cosmetic or elective dentistry, which would keep it out of standard insurance coverage. In that case, patients would pay out of pocket and prices would be higher. My prediction is the Japanese government will cover tooth regeneration for cases of congenital tooth absence, traumatic tooth loss, and possibly severe decay cases. Cosmetic applications, like regrowing a tooth you lost 20 years ago, might not be covered initially. All right, let's get to what you came here for, the actual price predictions. Based on everything we've analyzed, here are my predictions for TRG-035 pricing. In Japan, with a launch between 2026 and 2027, with insurance coverage, I predict 150,000 to 250,000 yen per tooth, which is about 1,000 to 1,700 US dollars. Without insurance coverage, it could be 400,000 to 600,000 yen per tooth, or $2,700 to $4,000. In the United States, with an estimated launch between 2028 and 2030, the initial launch price could be $6,000 to $10,000 per tooth. After 2 to 3 years, I see that dropping to $4,000 to $6,000 as competition and volume increase. In other Asian markets, launching between 2027 and 2029, we could see prices in South Korea from $2,000 to $3,500 per tooth. In China, $1,500 to $3,000, especially if domestic versions are developed. And in Southeast Asia, $2,500 to $4,500 per tooth. Now, here's an important caveat. These are per tooth prices. If you need multiple teeth regenerated, you might get a package discount. Clinical trials will likely start with single tooth cases before moving to multiple teeth, so the pricing model for that is not clear yet. Also, remember that these prices include the drug, administration, and basic follow-up. You may need additional costs for pre-treatment CT scans, which are $200 to $500. Orthodontic adjustments, if the tooth grows in crooked, which could be $1,000 to $3,000, and temporary prosthetics while waiting for the tooth to grow, which are $500 to $1,500. Before we wrap up, let's talk about wildcards, factors that could dramatically change these predictions. Factor 1 is competitor treatments. South Korea is developing a microneedle patch for tooth regeneration. If that proves effective and cheaper to manufacture, it could drive TRG-035 prices down significantly. Factor 2 is manufacturing breakthroughs. Monoclonal antibodies are expensive, partly because they're hard to produce. Any breakthrough in production efficiency could cut costs by 30 to 50%. Factor 3 is insurance lobbying. Dental insurance companies might push for coverage if tooth regeneration proves cheaper than implants long-term. This could expand access but also pressure prices downward. And Factor 4 is medical tourism. If prices vary significantly by country, medical tourism could boom. This happened with dental implants, forcing some markets to lower prices to compete. So there you have it, the most comprehensive cost analysis of Japan's tooth regrowth treatment available anywhere on YouTube. My bottom line prediction: expect to pay $2,000 to $4,000 per tooth in Japan by 2027, and $5,000 to $8,000 per tooth in the US by 2030. It won't be cheap initially, but it should be comparable to or slightly more expensive than dental implants. Is it worth it? That's a personal decision, but remember, you are getting your own biological tooth back, not a titanium post. For many people, that's priceless. If you found this analysis helpful, smash that like button and subscribe to Men's Health and Vitality for more cutting-edge health information. Drop a comment below and let me know. Would you pay these prices for tooth regeneration, or would you stick with traditional implants? Thanks for watching, guys, and I'll see you in the next video.